Welcome to today's program titled Web Broker Entities, How WBEs Can Drive Future Exchange Enrollment. At this time, all participants are in a listen-only mode. Later, we will conduct a live question and answer session. If you wish to ask a question live, you must be listening to this webinar on the telephone at that time. For those of you who are logged into the web presentation, you are encouraged to submit questions throughout the conference by selecting the chat pod located in the lower left corner of your screen, then type and send your question that way. For optimal sound quality, it is recommended that you listen to the conference via your telephone. Please do not forget to turn off your computer speakers if you choose to listen over the telephone. Look at the top left-hand column and click the speaker icon to turn the computer speakers on and off. If you choose to listen to the conference through your computer speakers and you experience any problems with the Internet sound quality, please dial back in on your telephones. I would now like to introduce our host for today's call, Steve Davis. Mr. Davis, you may begin.
Thanks, Karen. Hello and welcome to our program on WBEs. Today's free webinar is sponsored by Softheon. This is the second in a four-part webinar series. I'm Steve Davis, Managing Editor of Inside Health Insurance Exchanges and the AIS Report on Blue Cross and Blue Shield plans, both of which are published by Atlantic Information Services in Washington, D.C. After just 2 open enrollment periods, enrollment through public insurance exchanges has begun to flatten. Some industry observers warn that enrollment will continue to be hamstrung until health plans and WBEs are able to assist consumers in applying for exchange-based coverage and subsidies using their own websites. So we'll get the latest on WBEs and their potential impact today. And with us today are Eugene Sion, the founder, chairman, and CEO of Softheon, and Dan Schuyler, Senior Director of Exchange Technology at Levitt Partners, and their full bios are in your materials. You should have received an email containing a web link to the materials. Just to note, the slides you received last week have been replaced with a new and much more detailed deck. You should have received that from us just a few minutes ago. That full packet contains an outline for our program, the slides, some background material, and some articles. If you did not get the packet, please click on the Presentation tab to the left of your screen. You'll see a copy of the presentation materials that you can print out. After the presentation, we will open it up for your questions. And with that, let me hand things over to Eugene.
Thank you, Steve. And hi, everyone. This is Eugene Sion, CEO founder of Softheon. We are delighted to have you with us this afternoon, and thank you to those joining us from the Pacific time zone, and good morning to you all. As Steve pointed out, we are definitely going through some exciting times. The health plans have been relied upon heavily on the brokers and agents to drive enrollment, but in coming years, the WBEs, agents and other entities with websites approved by CMS are expected to play a meaningful part of enrolling plan members. So our topic of conversation today will be related to the WBEs and where we see the biggest disruption or the contributions that in the advent of public exchanges. And there are more than 50 WBEs are now registered and enrolled, and the individuals, employers, and their workers in health insurance exchanges, according to CMS records. We want to give you some little bit of a background, and perhaps from a Softheon's point of view, kind of taking a stake of where we are. When the ACA was first announced, and we heard so many different interpretations of it, what the ACA was really meant to be. Inevitably, the biggest concentration or attentions were given to the retailization aspect, the consumer websites, consumer-oriented websites. There were so many analogies made how HealthCare.gov was going to be the experience like at Expedia, Travelocity, and so on and so forth. As we look into those industries, how they have succeeded, I think one thing may be really worthwhile to understand really what it goes into the quote-unquote the supply chain transformation of travel industry, how we were able to make a transition from some of us old enough to know that there used to be travel agencies will book your flights to today that you're able to do this right on your mobiles. And really the magic, if you will, is in this little system called Sabre. Sabre was initially put together by several airlines, among the American Airlines being one of them, as a means of online ticketing, reservations, billing, even customer service. So as a complete business partner, Sabre today provides a comprehensive technology and solutions that give airlines the freedom to better market their airline, sell their products, and serve their customers efficiently across hundreds of thousands of websites. And in that context, basically, the Sabre, in essence, has become the wholesaler of the airline industry in that essence. So our vision is pretty much follows the same thought process. We believe that what we have as Softheon and what the industry is going through, the supply chain transformation of it. I'm pleased to report to you that basically we have nearly 50 health plans that today we act as a wholesaler. And what we do in essence, we help our business partners, the insurance carriers, to be able to focus on the member experience or the delivery of the services or better product pricing perhaps, to drive better product and services, especially to those in need of the affordable health care, if you will. And by doing so, in the context of the conversation that we refer to as the supply chain as a more like the FedEx of health insurance, if you will, the logistical aspect of it, we now know that after 2+ years in operation, that a lot complicated, a lot challenging, especially given the fact that the core admin systems that are being put in place by the carriers are having a difficult time adjusting to this real-time transactional system. Now, why we're talking about this, again, we want to be able to understand that because the way we see the evolution is there, the supply chain aspect too of insurance products will be sold through not only public exchanges and now the private exchanges. So from our perspective, it is a distribution channel, what really matters. So that the role of the WB is not only be able to provide enrollment in the context of the CMS as a WB for subsidized, but we also know that the non-subsidized population in the true context of private exchanges will continue to be the perhaps biggest driver beyond 2017 and so. So in that context, a little bit more about Softheon. We're a US-based technology company founded in 2000. We operate from the grounds of a university, which is ranked among the top public universities in the country. We also believe in collaborations and education. We work with many of our early adopters, as we call it. And if you haven't been, please, we urge you to come in and just visit us online. We have this wonderful newsletter, not as perhaps as diligent, as more in-depth as Steve's newsletters that he puts out at AIS, but nevertheless it gives you as a news aggregator, if you will, for you anything and everything about public and private exchanges, and we would love to be able to add you to our free subscriber list altogether. So the critical component of successful operations, especially as it relates to the WBs, we believe that there are 5 critical pillars, if you will. The HICS integration from an infrastructure point of view. We want to be able to make sure that you have a successful both 834 and very soon the 820 reconciliation processes. Ongoing consumer interactions through WBEs or the carrier-sponsor websites, whatever that it falls under, including as we've talked about, direct enrollment. We'll be talking about this soon. The billing and payment collection is a critical component to it. We also believe that exchanges is a holistic approach, not just about, I think we'll talk about today more extensively on WBE. However, in reality that the exchanges between the private and public, we believe it will converge, if not already being laid out. So our definition of a private exchange really is about an exchange that is run by a private entity, let it be a brokerage firm or carrier or some other entity. It is, however, able to enroll both subsidized and non-subsidized population. And I think in this topic, we'll talk about private exchanges as a means of enrolling a subsidized population by the WB designation. And the direct enrollment also falls into the same category. So the carriers can actually, brokers today can come in and enroll, as some of you might have experienced. We have done a sizable track record in that area. We worked in almost every one of our health plans that we have built. They are carrier-branded, consumer-facing web portals, and we'll talk about the impact of the recent direct enrollment regulations or the regulations to be able to do year-round enrollment, as well as starting next year, verbally we have been given a kind of a heads up that the changes will be now able to conduct it through carrier-branded portals. And then obviously Edge Server, we'll talk about, just to touch upon that, it is a critical component of creating a data-driven models and analytics. So in the context of WBEs, we believe that critical part of any WBE operation should include the ability to do enrollment and premium billing. And we do know that out of the 50 or so WBEs, that many of them actually has more of the, I would call it a business emphasis and focus, whereas some BWBs, like the Softheons of the world, we come from a technology end of it. As I commonly refer to, we are more like the plumbing and the boiler room operation. And we are able to work with, in fact, with some of the WBEs in the spirit of partnership, if you will, while they can provide a front office operation and we're able to provide the back office operation. Obviously, interfacing with the consumer in the context of, in this case, in fact, the consumer group can be expanded upon the employers and brokers and navigators as well too. So obviously, Federal Data Hub connectivity is a critical component of the process, as well as the premium billing, and in conjunction with that electronic bill payment and presentment component to it, including credit card authorization authentication, it is a critical part of the value proposition that we believe that WBEs must be able to provide in that context. Just to kind of peel the onion a little further, wanted to just show you the complexity of the system. It is not something that put together very hastily, if you will, given the opportunities. But we all know that the organizations have been making an investment over the last several years. And Softheon is one of those organizations that has been working very successfully and in a mutually beneficial win-win equation, if you will. And in this case, basically, our interface, as you can see, the lesser we touch the existing systems, meaning that we were able to fully leverage the existing investments and being able to connect the health carriers to the insurance exchanges, in essence, as I said, in a highly, if I may, a kind of a high-level description, as the wholesaler for the exchanges, if you will. There are many critical components to it. Again, this is just a kind of a slide that I think that speaks to the depth and the breadth of the technology that will drive and will continue to drive the ACA implementations in general in the WBEs. Again, the analytics is a very critical component to it. We all know that the brokers in general, they are very sensitive to the information about their membership informations, about breakdowns, their business in terms of the new business versus the current book of business, and not to mention their commission calculations. Having enrolled nearly 1 million lives in ACA in 2015, these are the type of dashboard experiences that we believe that as the consumers of this technology, the brokers and navigators, in general, the organizations who will be operating WBEs will be implementing or looking to implement through the partnerships with organizations like Softheon, for instance. Obviously, premium billing is a critical driver, and the payments are critical elements to it. Timely processing of the payments is extremely crucial to the individual's eligibility as far as the grace periods, and able to, in fact, get their claims being paid on a timely basis, and ultimately being able to execute those processes on a timely, proficient, and efficiencies. It translates itself into a lower call volume on your call centers, lower cost barrier to the entry to the systems, and quicker turnaround and profitability and sustainability. So again, premium billing is a critical part of the value proposition from a WBE perspective. And many organizations as they historically coming from the brokerage side of the business, they have done so. However, as you all know, on the ACA side, this is a little bit more complicated in the sense of because of the various provisions for an ACA, let it be grace periods and the enrollment, the gap in coverage, and sometimes unfortunately we continue to receive some data elements that causes the overlapping enrollment spans and so on and so forth. So especially in the ACA, since the ACA and CMS will continue to generate the 834 data as the source of truth, and this always will happen, even whether you're a WBE enrolling the member through the carrier portal through the direct enrollment or getting to HealthCare.gov. CMS will continue with the source of truth, and we will continue to have some data issues and the timing issues. So your billing system has to be robust enough to handle all those conditions. Again, being in the FFMs, and we also know that there are several state exchanges. Also, states are looking to WBEs operation as well too. Currently, the majority of the activities is being performed for the particular FFM component to it is through CMS and through the federal exchanges as we know it right now. So let's go just a one slide on the private exchanges. Again, we believe that in the very near future that distinction between the private and public exchanges will basically evaporate, if nothing else will converge. Because once again, through public exchanges, we know that there is a certain demographic, in fact, is a non-subsidized population, still being able to come through with the co-share reductions of $0 and 0 APTC. We do know that some consumers are basically feeling too comfortable halfway through their navigation to HealthCare.gov, and they continue to purchase the product. And unfortunately, our carriers are paying for their administrative fees and whatnot. However, conversely, on the direct enrollment side or WBE side, you will be able to, we believe, offer enrollments and underwrite enrollments for a subsidized population through the direct enrollment and WBE processes altogether. So we clearly believe that exchanges in general, this is something that needs to be watched upon, and clearly Dan will talk more about it. I presume that if you have any questions specifically, especially the Private Exchange Coalition, we are proud founder of that coalition. As you can see, we as independent vendors, sometimes we may appear to be competing with one another. We are a big believer of an industry that kind of a high tide, low tide, and rather than fighting for the slice, if you will, we have an ongoing dialogue and working relationship with these entities to bring more value to our constituents, our health plans, our brokers, and even government entities in general, but through the collaboration. So we want to do the heavy lifting. In fact, one of our initiatives is a data interoperability. Dan can speak to more about that topic as well. We wanted to kind of, in a way, come out of the gate kind of self-regulated as a self-regulated industry. We want to address the data discrepancies and data transferability as we see the consumer moving from one exchange to another, let it be federal exchanges to the state or vice versa, or within private to private exchanges. The utopian vision of an EMR, EHR, we believe that as the industry tackles that problem, independently, without the further mandates, we believe the outcome is always going to be much more consumer-friendly, rather than policy and procedure, so to speak, defined by some federal and state entities. Because just for the fact that technology is changing so rapidly, that we as private in the industry able to respond to those ever-changing requirements. And again, I think the final slide of the introduction is that this is a very recent, for those of you Gartner members, if you will, Gartner clients, recently published a 2015 hype cycle. And as you can really see, is the biggest growth as being predicted in a 2 to 5 year span, if you will. It is all about exchanges, both on the private exchanges and public exchanges. as Mark Bertillini himself predicted 75, and Accenture predicts about 100, McKinsey even higher. We believe that there is going to be a continuing demand and growth in the space altogether. So definitely we are into exciting times if we are not already. And you can also feel that from the M&As, if you will, taking place at I would call it a Tier 1 industry. We believe that will continue to trickle down and will go ultimately to more towards the consumer-driven business models through ACA, through private exchanges. And again, one slide on that conversation. This was also put together by the Exchange Evaluation Collaboration, not to be confused by the Private Exchange Coalition. This is another party that we are watching. We are looking to collaborate with them as well, and that there is an appetite towards it. In fact, Accenture that predicts that 6 million people in private exchanges this year will double it over the next several years, as high as maybe 10, 20 million next year. That number will reach out to. So let's go back to ACA. I think that's enough background on where we are right now. The biggest growth about ACA, as you know, that this year's growth was not really per stellar. After 8 initially was 12 initially, in fact 14, 15 million, then scaled to 12, and the final number I believe just about 10.2 million. However, having said that, the Bipartisan Congressional Budget Office predicts the ACA membership to reach out to 20+ million next year, and then it's going to be more of a plateau around 24, plus or minus, even if it's 20 million, 20% or so. We think the ACA membership will grow extensively over the next 12 to 18 months, and partly it is going to be driven by I think that to some of the early organizations, even though some of our private exchanges does not anticipate the effect of Cadillac tax, if you will, playing a role in the system, and we believe that there will be some early adopters. And for those of you who are following basically the latest IRS regulation. This was announced on February 23rd of 2015. And basically, the Cadillac tax is going to be a taxation on the small business owners altogether, primarily or the employers. It's basically to reduce the tax, the preferred treatment of employer-provided health care, as also to reducing the excess health care spending by employees and employers. So it's going to be basically a 40% tax and towards the cost of the healthcare coverage that exceeds the predetermined threshold amounts. And those amounts for the individuals around $10,000, and for family is going to be about $27,000. So just to let you know that on that notion about that, for someone is actually, let's say, a health plan cost about $11,000 for on the individual side. That basically individual will be taxed roughly about $300. If your individual self-coverage about plan costs about $15,000, you'll be taxed about roughly $2,000 per employee. Family coverage, anything plan costing about $28,000, you'll be taxed about $200. And if your plan costs about $36,000, it's basically the taxation could be as high as $3,400. So this is a taxation towards the kind of, I don't want to say penalizing the heavy utilization, but maybe perhaps the right wording is that the excessive unnecessary utilization. This is all outside of the cost share reductions and everything else too. So we're expecting a lot of more people into the system, and we're also expecting ever increasing the regulations and increasing competition also in line of that. So who are the WBEs? So the web brokers basically come in different flavors, but share a common goal with the marketplaces. In the context of ACA, they're using the internet as a distribution channel that makes it easier, faster, and cheaper to purchase health insurance in a consumer-oriented marketplace. The partnership between the web brokers and the marketplaces are mutually beneficial. And this unique relationship has established a means for consumers and brokers to embrace a healthcare shopping experience through utilizing direct enrollment pathways. So direct enrollment, as some of you may be aware, that this was a technology introduced in fact, starting 2014 from the get-go. And for a while, in fact, was considered as the savior of under the issues and technical challenges of HealthCare.gov, to able to basically private industry to take more of the consumer engagement through direct enrollments. So we'll talk more about the current state of the direct enrollment and then the future state of the direct enrollments. And the marketplace has achieved a considerable public awareness as for the last several years, and now that basically we believe that the web brokers will represent and provide the technology and the consumer-friendly innovations through the consumer-directed health sites and websites are going to be put out by the private entities. And then we believe that will increase the sales capacity and increase the value of overall marketplaces, and then looking to become more self-sustaining entities. As we go into the web brokers, so according to CMS, the web brokers are referred as the agents or brokers that enroll individuals that are qualified, or as well as the employers and families through the public-facing websites. After the successful implementation of FFM registration of the brokers and the training of those individuals, that each web broker is equipped with handle individual and small group enrollments, as well as the challenges that has emerged from it. And by the way, I just want to make sure that there will be a copy of the slides. If not already available, I'll turn over to Steve. Maybe just take a moment. Does the slides were already sent out to the registrants, or will be available for download? I'm already noticing some messages on our chat board.
They are available on the screen to the left-hand side. You can click on the materials and print those out. They were also transmitted to all of the attendees. And Eugene, why don't we take a break here and hear from Dan, because we're getting close on time and haven't heard from Dan yet. And then we can get into some of these topics that we had identified to chat about on web broker entities. So Dan, how are you?
Good. And Eugene and Steve, thank you both for asking me to participate. This is a topic that I have a lot of interest in, and it's a fun discussion. I would just go back to what Eugene was talking about with Sabre. Back in 2011, a friend of mine who had a good understanding of the architecture of exchanges and the complexities, he and I were talking about, somebody needs to get in there and make this a lot easier, and we talked about Travelocity, and we ended up on Sabre saying Sabre should get into this business. I mean, they should be the conduit between the exchanges and the carriers. It looks like Sabre didn't see the vision, Softheon didn't, but I say that because the goal of the ACA is to really increase access to healthcare and provide access to affordable health care. And if you look at the web brokers, they've been enrolling and assisting consumers with the purchase of their health plans for decades. And I think this is a really good opportunity for public and private partnerships, not only with the FFM as web brokers are doing right now, but also with state-based marketplaces. So I think you can combine the best of both worlds by starting to explore these public-private partnerships with web brokers and state-based marketplaces. So I just wanted to add that. I think that's a worthy goal for everyone to consider.
Good, thanks, Dan. And can we talk about what some of the challenges are that WBEs face, where WBEs are now, and what the hope is for WBEs, and maybe talk a little bit about just the enrollment system?
Sure, I'll start off, and then I'll look to Eugene for his thoughts. So right now, the WBEs are doing direct enrollment or facilitated direct enrollment vis-a-vis the FFM through web services and technologies that for the most part worked but didn't work. The experience from a consumer perspective was not the best because there was this double redirect where the consumer would go to the web broker's portal and then have to go to the FFM and then back. CMS is working to develop a technology to improve that experience. And again, I go back to talking about how web brokers can provide additional channels for consumers to access healthcare, and hopefully we'll see that technology mature very soon, and it will allow web brokers to provide consumers with a more seamless experience enrolling in health plans vis-a-vis the technologies that CMS is offering and providing. On the state-based marketplace side, I think like the federal exchange, they were so focused on just getting that technology up and running, they really didn't have a lot of time to focus on the technologies to integrate web brokers with the state-based marketplaces. And to Eugene's point, there's lots of conversations going on with state-based marketplaces with respect to how do we increase enrollment, how do we provide additional channels to enrollment, and those conversations are including web brokers and how to create a seamless interface to achieve that goal, so we can create additional channels for enrollment through state-based marketplaces as well. And so I think as those conversations start to mature, we'll start to see state-based marketplaces embrace web brokers and utilize their technologies to provide additional channels for enrollment.
Thanks, Dan. And Eugene, any thoughts on that? And when might we see some changes or more ability of web broker entities to enroll people and give people subsidies?
Sure. So to Dan's comment, and I think that I concur with everything that he said, and he's one of those individuals really got his fingers on the pulse, and not to mention going back to his Utah days, I think he's been extremely foresight. He has a foresight and the vision to really understand what's really going behind the scene altogether with the ACA and exchanges in general. I think what really, it's good, bad, or ugly, where we are today is an interesting junction from our point of view. So we believe that the long-term sustainability in general about the exchanges is that the overall consumer engagements will be much better served and perhaps much more sustainable and in the sense that and successful in general if we get the private entities. In this case, as you know, the provision of the ACA, the direct enrollment provision. So this particular slide, in fact, talks about what is available today. We know that many organizations have some technical challenges with the EDI processing and premium billing that they do not really get a chance to evaluate and maybe successfully implement the direct enrollment. But last 2 years, I will call some of the organizations, and we were one of the entities provided the technology to all our carriers that able to provide a carrier-branded websites. The big challenge about those of you, I don't want to go into great details, and there's a lot of, and at the end of the presentation, there are some URL references that you're able to pull down many of these documents directly from the CMS zone or even public websites. That basically the problem with the initial implementation is this commonly also called double redirect. It is not a consumer user-friendly engagement altogether. Imagine halfway through the transaction that we have to tell the consumer that now you're going to go to HealthCare.gov, and then some point in time they're going to come back and they're being redirected back to us. It is a very, very, I would call it a poorly designed, executed model altogether too. And one of the biggest, I will say that the biggest win for the industry will be if we can convince our colleagues, some of our policy makers, if you will, opening up the services to really bring it in line with 21st century. How we were able to, in fact, make calls to, using Google APIs or using Facebook APIs and so many other technologies like those available in a safe and secure manner. As simple as that, if we were able to do the identity proofing and the subsidy calculation as simple as, for instance, credit card authorization, a simple thumbs up and thumbs down about the member's citizenship status, and a simple value about what's the advanced tax credit, and these are again to be reconciled. If we were able to make that a true APIs, that the entire transaction of enrollment underwriting and thereafter the maintenance of that individual's policy could be shifted to the private entities. So private exchanges, in essence, will be fully and can be fully implemented in a way that to manage the entire subsidized population. So today, we're able to do about 75 to 80% of the process. So this particular slide talks about that component altogether. And if you would like to take a look at the next slide, which we talk about basically your typical swim lane. And again, this is the current state of the direct enrollment. So once the brokers are being, either again, they're able to do this kind of services through, through private broker-based entities serving as the WBEs, or the brokers able to enroll through carrier-directed portals, if you will. Today's interaction is, you can see, is that two different swim lanes beyond the initial registration component to it, but on an ongoing basis. Now, bear in mind, there are great benefits. In fact, the brokers loved using this interface. If nothing else, in 2015, the broker redirect to FFM as a result of this particular component, if you will, it bypassed many screens and it actually has a fewer number of screens on the FFM as it relates to individuals' citizenships, the validations and identity proofing, as well as their tax records and so on and so forth. So it is still a streamlined, but yet it's still, there's a long way to go in this current model altogether. Once again, there are quite a few documentation available both on the CMS side. Where we are excited about it is the future state. But before I jump into it, I'll turn over back to you and Dan, if you would like to add more comments about what you were hearing from the other quote-unquote, just not I will call the carriers, but also the other industry vendors. Once again, we really view this opportunity as an industry movement rather than one or two successful companies, dominating the field. So we see greater opportunity for collaboration and working together, given the fact that, again, in a several year, could be about 100+ million lives, and we can all take some great part about serving the community. So I'll turn over to you, Steve, and maybe Dan, you would like to add some comments here.
Thanks, Eugene. And Dan, could you just maybe explain the double redirect process and just what the challenges are? And from what I understand, there's just no way to know if a customer makes it through or where they wind up.
Sure. So what happens is a consumer goes to a web broker's portal to start looking at health plans that they may be interested in. They use their consumer decision support tools, and they look at those plans, and now they want to qualify for a premium tax credit or subsidy, if you will. And in order to do that, the web broker has to hand them off to the FFM, the Federal Exchange, to facilitate the eligibility determination for the premium subsidy. So that happens on the FFM side. Now, to your point, Steve, and to Eugene's point, what can happen, and happens quite frequently, is the consumer gets lost on the FFM and doesn't know how to get back to the web broker's portal. And they have the ability to shop on the FFM, which is one of the requirements to allow a web broker to connect to the FFM. The consumer can either continue to shop on the web broker's portal or on the FFM, and we're seeing, because of this redirect, if you will, the consumer gets lost on the FFM. They don't know how to get back to the WBE. They purchase their insurance on the FFM and not the WBE, and then the WBE does not get credit for that purchase. And so that's the double redirect. And now the consumers that can get back to the web broker's portal, and that usually happens through hand-holding, if you will, where the web broker is actually facilitating the enrollment process over the phone with the consumer to make sure that they can get back to the web broker's portal. So as Eugene mentioned, it's not a very consumer-friendly process, and if the web broker picks a plan on the FFM, or if the consumer picks a plan on the FFM versus the web broker's portal, the web broker doesn't get attribution for that purchase. They are making improvements to that process, so it's easier for the consumer to get back to the web broker's portal, but they still have to do that redirect right now to qualify for the premium subsidies. The goal is to allow the web brokers to send the data directly to the FFM, or what we call the Federal Data Services Hub, which is a component of the FFM that does the actual eligibility determination for the subsidy. And then once that subsidy determination has been made, that calculation will be sent back to the WBE. that the WBE will tell the consumer what their subsidy is, and they'll be able to continue to shop on the web broker's portal without having to go to the FFM. That's the technology that's in development right now, which would make the process much more intuitive and seamless for the consumer and provide a much better consumer experience and would eliminate that double redirect altogether.
And when might that become a reality? When might we see that?
Well, unfortunately, I don't think we're going to see it for this enrollment cycle. From what we know from CMS, they're really working diligently to have this ready for 2017. So we might see it this year, but I highly doubt it. But next year is when it's scheduled on the technology roadmap to be completely implemented.
Okay. Yeah, from what I understand, this is something they want to do, but they just don't have the resources right now to complete it.
Yeah, I would say that's primarily the impediment. It's the resources to develop the technology and to do the testing in enough time to have it ready for this year's open enrollment.
Okay. And what's the latest on CMS's EVaaS interface that would link carriers to WBEs?
Well, so that's the technology. That's the technology that we're talking about that would completely eliminate the double redirect, allow the WBE to send the necessary data to the Federal Data Services Hub to do the eligibility determination for the premium subsidy. The Data Services Hub would send that back to the WBE. You wouldn't have to do this double redirect, thus providing a much quicker, a much more seamless and intuitive experience for the consumer.
And Eugene, any thoughts on this, on where this is going? Have you heard anything on from CMS about where they are on this process, and will something like this be ready for 2017?
Sure. I think that following up to Dan's comment about that too. So we believe that this whole interface, which I'm not sure if you're able to follow my little markers in here. Basically, EVaaS will eliminate all that communication back and forth while keeping the consumer on the WBE portal, if you will, and then all that communication takes behind the scene. As I said, could be as simple as, if it's rightly designed and implemented, as like a credit card authorization process altogether too. The exciting thing about direct enrollment, there are some encouraging signs, if you will. I think the first year or two, direct enrollment was only available during the open enrollment season. As you know, that now direct enrollment is available as part of a special enrollment program SEP, so it's available now year-round. So that's a one small positive, encouraging sign, if you will. We were also informed, and we're still looking for some ways to verify this thing. There was a verbal update that around May timeframe, that there was a conversation that the changes will then be also allowed through direct enrollment portal. Again, step-by-step process, kind of we are crawling before we start running with ideal platform or solution like EVaaS. So we believe that the changes will be another great tool. As you know, that beyond the initial enrollment, anytime the consumer wants to make a change in their coverage or plans, or even wants to add a dependent or whatnot, they are required to go back to HealthCare.gov. We would love to be able to keep that interface on WBEs or carrier directed portals altogether too, so that basically we can continue to engage with our consumers as it is. And our portals enables members to come in and make a payment, be able to print their SBCs, and able to even print their ID cards. Well, those services are not available on the HealthCare.gov, so they are required, and members are required to go to our carrier portals. Unfortunately, they cannot make even a simple address change or adding a dependent. So it's a very, I will say that convoluted process. So we would love to be able to see the change component to it is also a great value. And to be frank with you, from a I would call the challenge perspective, 80% of our challenges are related to individuals has follow-up questions or changes to their plans and whatnot. So EVaaS will be an ideal thing for us, but some of our pain points from some of our carriers' perspective is actually these kind of issues, which many of them, by the way, ends up becoming a Hicks cases. It reaches to the Department of Insurance, if not the consumers making files and complaints and appeals with CMS and so on and so forth. So this is a one sensitive area we also would like to see. Again, we hope that our friends from the administration are able to put in some resources to really make these more 21st century APIs and web APIs, and let organizations like Softheon and others be able to maintain and continue to service the members altogether too. So EVaaS will be an ideal thing for us, but I think that there are a lot of complications. And to be frank with you, we have very limited, I will call it, visibility to the whole process. We heard from the rumors that basically there are hundreds of people working at nearby Virginia doing this, the identity proofing and then the tax credit calculations altogether. Whereas we are able to do that using the Magi rules. We have a simple tax calculator. But again, we have very little visibility to some of the challenges that are being, I guess, let it be SSA or Homeland Security or IRS system, having access to the data and making that a real-time service. But again, as I said, as important as EVaaS is, I think that having the change process being done through direct enrollment will be another major milestone towards that ultimate goal of really completely privatize consumer engagement for subsidized populations through WBEs. That will be one of our ideal goals.
Great. Eugene, are you ready to take some questions?
Sure, absolutely.
Okay.
I'll flip it over, and then last slide, where our audience, if they haven't had a chance to download the slides, these are some of the URL references. Some of them are technical, some of them are policy, but feel free to reference those back and CMS slides. So yes, of course, we're ready for your questions.
Okay, great. Karen, can you explain how to ask a telephone question?
Sure. To ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question that way. If you'd like to ask a question via the telephone, please press *1 on your phone now, and you will be placed in the queue in the order received. If your question has been answered or you wish to remove yourself from the queue, press *1 again. I will announce each caller prior to bringing you into the conference. Please remember that if you have your phone on mute, take it off mute when you're selected to ask your question. Again, to ask a question via the web presentation, select the chat pod located in the lower left corner of your screen, then type and send your question. Steve, we're ready to begin.
Great. Thanks, Karen. First question through the chat pod, somebody asked, we are currently seeing companies like Health Sherpa and eHealth that are able to complete the enrollment process with subsidies on their own site with what looks like no redirect. Is this EVaaS, or are they using some kind of technology to be able to use this? Can either of you, is this something you're familiar with?
Well, I will speak from our perspective. Right now, there's no such service available, so I cannot speak with, again, those particular WBE solutions altogether out there. We do know that basically, some of them might be using a calculator, an estimator, if you will, and then basically, sharing that information with the consumers. At this point, I'm not aware that anyone has some kind of a secret APIs. I'll turn over to Dan. Dan, any comments?
I would just add that I think a lot of those transactions are happening probably over the phone, where the web broker is assisting the consumer in doing the actual enrollment process. So the web broker is acting as the consumer doing the enrollment, going through the subsidy determination and completing the process that way. But I'm not aware of any other APIs or web services that would allow a web broker to connect or bypass the current double redirect right now.
Yeah, that was a question that came up a couple different instances. Somebody else said that some WBEs are claiming that they can avoid sending clients to HealthCare.gov and circumvent the double redirect process. But that's, as far as you know, that's something that just can't be done.
We are not aware of it. Again, as a navigator, if the brokers are playing the navigator role, if you will, and they're able to key in the data on behalf of the member while they're on the phone or using some screen sharing technologies and whatnot, whatever that might be, those options are available. But they are not in a more systematic base, if you will, as Dan alluded. Again, I think that our hypothesis in this case it could be one of those conditions that we're able to provide some assistance above and beyond the self-serve WB in the true nature that the consumer are able to do this on their own.
Okay, great. Another question from the chat pod. Do you have any insight into how this model can bring unsubsidized lives to the state exchanges? I'll throw that one over to you, Dan.
Well, sure. Again, I think the web brokers provide additional channels for enrollment. If a consumer wants to see all of the plans that are available on a state-based marketplace or in the FFM, the web broker can help facilitate and show the consumer all of the plans that are available. Whether or not they qualify for a subsidy, they're still able to purchase a health plan. I mean, a majority of the plans being purchased on both the state-based marketplaces and the FFM are subsidized, but certainly there is non-subsidized consumerism taking place as well. And again, I think web brokers just provide additional channel, vehicle, consumer decision support tools to allow purchase of non-subsidized health plans.
Excellent. Anything to add to that, Eugene?
No, I think that Dan is right on the mark there too. So I believe that the brokers community will bring another channel of education, and really the healthcare still continues to be a very challenging task, despite the fact that we all need one. Unfortunately, it is a very overly complicated, perhaps. It's the nature of the business, and I think that the leveraging the skills and relationship that brokers have with their local communities, down to the individuals, and even possibly in small businesses, we believe those individuals could be best served with some guidance and support from the brokers. And we believe that is a big differentiator, because you can also see this in general if you look into the ACA enrollment numbers, and it's just a disparity between the states, and that is really as a result of the culture. And I believe the broker community will be able to address some of those challenges around the confusion and frustration that the consumers are facing. With some guided help, the brokers will make a big difference.
Excellent. Thank you. And somebody asked, how many WBE consumers percentage-wise are lost to the FFM double redirect process? And I saw that question. I looked through something I wrote back in May, which is in your materials, and a percentage I got from Get Insured. They were estimating 50% to as much as 75% of applicants are lost in that process. Any thoughts on that, Eugene or Dan? Does that jive with what you're seeing?
I don't know what the current percentages are. Maybe Eugene might have a better insight into that.
Yeah, it's kind of, you know what you know, you don't know what you don't know. Obviously, we would not know that until the consumer comes back and raise some kind of a yellow flags about their frustration, the whole process. We do know that it's a high number, especially one of the reasons that, again, this was also compounded by the fact that the direct enrollment, the double redirect probably wasn't working as smooth back in last year. We had a much higher success rate this year, but organizations, some of them have given up altogether too. They really didn't continue to invest. And every time when you have an exception, like for instance, I do recall that one of the exceptions that if you enter some wrong value and just you get like one of those 404 messages that kind of the website is broken because the whole process was not designed to handle those data exceptions, if you will. So as a result of it, that we had a high number of occurrences. But number this year was a lot lesser. We felt that the overall success rate, at least I should say, the DE, direct enrollment based enrollment, much higher than the last year, which to me is that suggests a much lesser consumer, quote unquote, lost in the transaction. But The numbers are, I think, really some double digits. I will say in our case this year was more like a low teens, maybe early low 20s. But I cannot really tell you what the exact numbers are because it's very difficult to maintain decision properties from a consumer coming for the first time, going to HealthCare.gov and coming back. Those decision properties are not consistent right now as we were to if we measure that performance.
Okay, thanks, Eugene. And a question about decision support tools. What do you think about the decision support tools that are currently available on exchanges, and what is an example of a cutting-edge decision support tool?
Well, I'll be biased to that question. I'll turn over to Dan for his objection.
So we've seen the decision support tools on the state-based marketplaces and the FFM go through a series of iterations, and they've improved dramatically year over year. And both the states, the federal government, and the vendors are working together to continually improve the decision support tools by gathering feedback from consumers, monitoring what they're doing on the marketplaces, if you will, and using that data to determine how to make iterative changes to improve that experience. I'm not going to pick out a single tool, if you will, but I would say that many of the state-based marketplaces are leveraging technologies that provide really good, robust, intuitive interfaces, and we've seen the FFM improve dramatically this enrollment period with the improvements they've made. So this technology will never be the solution for the driving consumerism, and it will continue to improve and iterate, and I think we'll continue to see that over the next couple of years.
Thanks, Dan. And Eugene, did you have a comment on that, biased or not?
I think the challenge about that, really, the smart guiding tools, I will say, in the ACA space is a little challenging just for the mere fact that basically, underwriting rules in ACA side is so straightforward in a sense that it's almost like guaranteed issued, right? I mean, there's so few parameters that you can really enter into it. But if we think that towards the more commercial, more mature shopping experiences as we get into the true private exchange for non-subsidized populations with a complicated underwriting rule will basically help plans to create, I will call, the better shopping experiences, kind of tailoring a better product. May or may not be, quote unquote, ACA compliant. In other words, it cannot be a QHP per se. But we believe that once we have the consumers really starting getting comfortable through the websites, buying the product and services, we believe the industry will innovate and create different products and services. Obviously, the ideal utopian vision will be about building my own product. So we believe there's some way from here to there, but I think that once the innovation and technology really in the hands of private sector, opportunities to create a better shopping experience and guided shoppings and better informations and so on and so forth, I think you're going to continue to see that kind of innovation and disruption from companies like Softheon and others.
Good, thank you. We've got time for one or two more questions. Another question from the chat pod. And this is something that I think goes to your presentation, Eugene. What is your vision of blending private exchanges, fully or self-insured, and public exchanges in order to deliver a more cohesive enrollment process, taking into account ACA eligibility and essential/affordable coverage, especially among large employers greater than 20,000 lives?
Sure. So obviously, the EVaaS will be critical to this process because without that, we are kind of driving 90 miles an hour, and then we have to stop and we have to send the consumer, everybody get off the bus and go somewhere else and come back. Hopefully, they all come back and will continue to ride. So that's giving that kind of a crude analogy, if you will. But in the essence of the technology like EVaaS and mature technologies, we believe that there should be no distinction between private and public exchanges. And again, as I said, private exchange could very well manage a non-subsidized as well as a subsidized population through commercial products, including defined contributions and so on and so forth. Basically, we believe in the very short term, and if you really put into the I'll call the future challenges about the sustainability of the public exchanges. So every one of them having some difficulties, as we all know. Some of them are shutting down their operations, just as Oregon, Nevada did it last year, and Hawaii is probably in the process of doing. Vermont maybe do the same thing. Maryland may do the same thing. So the FFM, even though it was a Plan B, it now all of a sudden became a Plan A. So now that basically, I think that the sustainability of ACA, it always remains to be a great question. But enabling EVaaS will open up a lot of doors for private exchanges to be able to cater to both subsidized and non-subsidized population. When we get to that point, it really then we're going to see probably another iteration, especially the self-insured large groups able to create their own multi-carrier exchanges. And some will be done through organizations like Aon or Tower and whatnot. But then also we can see large organizations being able to create their quote-unquote their branded white label, if you will, catering to their employees only. And in that group, once we do this, as we already have witnessed, we're going to see organizations really taking a very creative approach. Obviously, excise tax, the Cadillac tax will play a great role in that context too. We'll see a lot more policies and decisions from corporations pushing their employees to be more stakeholder of their own quote-unquote destiny. So in that context, if you're a part-timer, if you're a minimum wager, you might be qualified for a subsidy. So why not take advantage of the situation? Or if you are in a particular demographic and so on and so forth, you might be far better suited by even other type of Medicaid programs. So we're going to continue to see innovation throughout the place. And I think that, again, as I said, look, 18% of our GDP for one of the wealthiest and the country in the world, and most successful one, yet such a poor outcome, OECDs and all the other ranking, you look into where we stand up altogether, the consumer has to be a stakeholder in the process. Every time we disfranchise a consumer, we basically got into a bigger mess than we start with. So I think that we need individuals. We love doing our own online banking. We love doing our own travel arrangements. We are not afraid of technology anymore, as it used to be in the past. If we can just simply make the process a little simpler, people to understand, and make that technology much more fluent, putting the consumer in the center rather than the policies and procedures and building a product around that. But if we put the consumer in the center, regardless who that is, individuals, small group employees, minimum wagers, part-timers, and then private technology, I'm certain that we'll come up with a product and services to best cater to that individual.
Great. Thanks, Eugene. Well, it looks like we're out of time. We had some great questions, great dialogue. Sorry we weren't able to get to all the questions. Dan and Eugene, thank you very much for a really spectacular dialogue. Thanks for your thoughts. And I understand that some people may have had some problems downloading the materials and they are being reloaded. Karen, can you explain how to get to those materials?
Yes, thank you, Steve. We have emailed the new materials to you, so you will get them that way. But if you give us a minute after our presentation is complete here, we'll reload the materials, and you will find them in the Handouts tab on the left-hand side of your screen. So just give us a few minutes after we're done, and we'll have that there for you. Steve, any other closing comments?
Great. That's all I have. Eugene, Dan, anything else any closing comments?
Well, my only comment is about that we urge the industry. I think, again, as I said, these are exciting times. I think that, and Dan and the team at Levitt Partners, we urge our colleagues to reach out to Dan and team. We have great efforts about Private Exchange Coalition. We would love to see more participants, more great minds around the like-minded people around the table, if you will. I think one of the things that we have to do as an industry, we have to be a kind of start speaking from a single voice and look at an eye in the horizon, if you will, and build something really. I think that we all have a great meaning at the end of it, if you will. And if we do a great job, we will get paid. That is our mission. So we urge our colleagues. I see that quite a few of what I would call our competitions, but I will view them as our competitions. We are looking forward to collaborate with you and under the watchful eyes of Lovett Partners, and look forward to having an opportunity to continue dialogue.
Great. Thanks, Eugene. And included in the materials is a white paper that the Private Exchange Coalition came out with, I think, last week. Dan, any closing comments or any comments on that white paper?
I would just add that I think there is on the horizon an opportunity for both public and private partnerships, and I think over the next 6 to 12 months, 24 months and out, we're going to see these public-private partnerships start to flourish, and I think the web brokers will be part of that discussion.
Great. Well, thank you both, and thank you also to our audience. Have a nice day, everybody.
Thank you.
Thank you.
This concludes today's webinar. Thank you for attending.